I guess the first thing I want to address is just the size of this merger. This is large. These are two very big employers, hospital systems, as it stands in Minnesota even. Why is bigger better?
Well, I would start with this. The size is material. It's, certainly not, as big as some of the other really, really large mega systems across the country. But even setting that aside, the merging of Sanford Health and Fairview Health Services is not about just to get bigger. We've had many opportunities at our organization, I know Fairview has as well, where you could grow for the sake of growth. And we've declined those opportunities because they just, at the end of the day, don't make sense for our patients. And so what this is really about is why does it make sense to bring the two organizations together, size aside? The reason why that is because we have two organizations, two 501c3 not-for-profit organizations that are committed to providing care for our patients and for our communities, in doing so in the upper Midwest. And so we have a real unique situation where you have two organizations serving in the same area of the country, but we don't have overlap. And that's a real important distinction. So we're close enough for it to be relevant and matter for our patients, for our communities, and for our caregivers, but we don't run into a situation where we have two organizations that are now overlapping or that we're competing in the same markets. And so it really creates a very unique opportunity for us to bring together all the resources of our organization with a singular focus. How do we bring world-class care to our patients, whether you're living in the most rural parts of the state of Minnesota, whether you're living in our tribal communities, or whether you're living in a more densely populated urban community.
So how does this accomplish that?
By bringing the companies together, one, it allows us to, again, as we bring together the resources, to create a sustainable model where we combine those resources to provide the necessary assurance for our patients that we can make the investments that are absolutely necessary for them to have world-class care. Technology, one of the largest cost drivers in not-for-profit healthcare delivery today. And a lot of those are really at a fixed rate. So whether Sanford Health does it or Fairview does it, the cost is the same. But our ability then to scale that and to spread that cost out over two organizations is a significant opportunity. As an example, we announced last year at Sanford Health, we have a $350 million virtual care initiative. And that's aimed at bringing world-class research, world-class care delivery to the most rural parts of the upper Midwest in America's heartland, as well as extending those services into those densely populated urban communities. That's something that we're going to make great use of at Sanford Health. But when we look at our opportunity and the synergies to use that infrastructure, the cost is already covered, and then combine that with Fairview's expertise, that's going to allow us to double, triple, quadruple the impact that we'll be able to have, but without having to increase the cost for the system.
Yeah, let me give you a couple specific examples of that. So if you think about nursing, the recent national study, bedside nurses spend 25% of their time in direct patient care. 75% is in documentation and other kind of administrative duties. So let's say you're a single hospital and you spend $1 million to really address that, to automate a lot of those administrative things, to make documentation easier. Well, it costs you $1 million. If you have 10 hospitals, now you're at 100,000. If you have 100 hospitals, and again, you see the point, right? The opportunity to be able to drive innovation is crucial, and that's where size makes a difference. But we should be very clear, healthcare delivery systems are in crisis. It's happening across the country. And it's a result of COVID, it's a result of all the things that happened with labor and supplies after COVID. And just to give a sense of scale, if you look at the biggest pharmaceutical companies, their market cap is $3.4 trillion. You take the 7 largest managed care organizations, their market cap is $8 trillion. So yes, our merger is big by some standards, but relative to the rest of the healthcare ecosystem, not really.
James, I wanted to ask you about that because when you talk about sustainable model and crisis, the two bottom lines of these two are very different right now. Mm-hmm. How sustainable is the future for Fairview without a merger?
Well, it's sustainable, but I think in a different way. So my team and I have been working very hard. We've got great progress over the last quarter. This quarter, we're off to a great start. I do believe there's line of sight to having positive margins. The problem is we live in a very capital-intensive environment. We're sitting in a hospital. Hospitals have lots of equipment, lots of expensive rooms, lots of expensive people that have to be brought to bear. And if we're going to stay current with technology and with equipment, that costs a lot of money. And these are 7x24 operations. So if you really want to stay current, you can't just break even. You can't just have 1% margins. You have to make enough. And just as a reminder, we're 501c3 not-for-profits. We don't have shareholders. That money goes directly back into our communities and into our organizations. So the ability to get combined with Sanford gives us a different pathway than if we were alone. We would be able to exist, but not to thrive in the way that Minnesotans deserve.
Yeah. One thing I would add to that, if it's okay, is right now it's important that we have the public, make sure that our patients, make sure that our elected officials understand that right now there's a conversation going on around, do you stay the same or do we make the step forward and merge the two organizations together? And that's really a false sort of equation in front of you. The opportunity to stay the same and just assume that the world that we have today, the services that are available, are going to continue to exist into the future is just simply not true. And so what we want to make sure is that people don't sort of fall into this false choice perspective. And what I mean by that is not only the challenges that you talked about there, but the majority of not-for-profit health systems in 2022 lost money. And the trend shows that that's going to get worse before it gets better. And because of what we do, which is meeting the needs of our patients and our communities, it means delivering services like mental health. It means delivering services for pediatrics. Those are not services that make money. Those will always lose money as a part of not-for-profit organizations, but we do it because it's part of our mission. And then if we aren't in the communities, big, small, anywhere in between, nobody else is going to provide those services. The for-profits certainly are not going to do that. And we can't put more weight on the backs of our government and tell them to do it and tell them to figure out the infrastructure to make that happen. That's why not-for-profit health systems exist. And so we believe it's very important that people understand that it's not only that sustainable model, but it's also how are we going to offer new things to our patients. Today at Sanford Health alone, we take great pride in the fact that we're a great place for active clinical trials. We have over 300 of those across our system. Today, our active oncology patients, 13% of them are on clinical trials, which translates to access to life-saving care. The national average is only 3%. And today at Sanford Health, we're able to integrate those. We're able to attract both in-market and out-of-market clinical trials. But by bringing Sanford Health together with Fairview Health Services, that opens wide those demographics, and now we're that much more attractive. We're a better place to bring clinical trials because it's a more diverse place from every way you look at that, from an ethnicity perspective, from a socioeconomic perspective. And so these are some of the ways that not only just sustainable, we want to make sure people know that they're going to get even better care and better access into the future.
Let me ask you about better care, because I'm sure as you've heard in some of these meetings, there's a lot of literature out there that's looked into mergers saying that costs tend to go up and care stays the same or declines. Why would this be any different than that?
Well, yeah, go ahead.
Let me take a first shot at that. So, look, I'm a recovering statistician, so I could argue methodological issues, but let's just argue necessary and sufficient conditions. No one should argue that a merger by itself is going to yield anything. Higher costs, lower costs, higher quality, et cetera. Because it also takes a dedication to actually achieving those things, an intent. That's part of why, I think this combination makes so much sense to me, is that if you look at what drives Fairview and what drives Sanford in terms of improving quality, improving safety, driving down cost structures, creating a better patient experience, that intent is there. So there are affordances that we get by being bigger, but nobody should believe that any merger by itself is really going to have any kind of impact, positive or negative, just by the sheer fact of bringing two organizations together.
Yeah, if I could, one thing I would add to that is getting a little bit into the methodology just for a second, but as you'll note, most of those studies refer to market consolidation, where you have two competitors who come together within a similar MSA or marketplace and then create that consolidation that results in escalating costs. Not applicable here because, again, our organizations don't cross over. We don't have that overlap, so we don't have that scenario that's in front of us today. But what I would say is set aside all of the sort of theoretical and just hold us accountable to what we've done in the past. So I would invite anybody who's concerned about that and has those questions to look closely at Bemidji, look closely at Worthington, two locations where we've had the privilege to visit in the past 2 weeks with the Attorney General's office, and hear what the impact has been as we've entered into those communities and we've merged. Over $100 million of strategic capital that's been invested in Bemidji. That's adding specialty services like oncology, like orthopedics. It's adding mental health services. It actually has now the state's first pediatric empath facility. And so it's doing more in these communities, not doing less. And so I'm as confident as I've ever been about what we'll be able to do. Some of that's because of the vision that we have in front of us, but a lot of it is the history behind us.
Let me add just a little bit, because you opened up the door, so I'm going to walk through it. So the other thing from a methodological perspective is I would urge everybody to look at who sponsors many of these studies. These are not pure academic studies. These are usually sponsored by somebody who has a point of view or wants to create a point of view for people. But I would also, Bill cited many great examples within Sanford. I would cite, we merged with Health East several years ago. Our quality, our safety is higher, is improved significantly since that time. Now, was that a direct result of the merger? Well, no, but we were able to learn from each other, and because we had the intent, you can see the demonstrable results from that.
There's been a lot of talk about the financial realities that frankly are harder for hospitals right now. How is it that coming together and using that size to leverage with insurers and other things isn't part of that equation? That's what I don't really understand, because isn't that all part of this? And when we're talking about costs, that's what I mean.
Appreciate you asking the question. No, that's not a part of it. And again, some of the studies that have been cited and the concerns, those involve organizations that are consolidating within the same MSA, right? They're coming together within the same marketplace to then begin to leverage that size and scale against payers. That's fundamentally not the situation here between Sanford Health and Fairview Health Services. And to be honest with you, that's not the value proposition. At the end of the day, as healthcare delivery systems, especially as not-for-profits, we're more often price takers. The majority of that being from our governmental payers, and then the other aspects of that from our commercial payers. And that's just the reality. We work closely with them, we try and drive partnerships with them, but it's a competitive environment. It is what it is. Our best option to be able to control those costs into the future is our ability to be able to use that size and use that scale to be able to invest in things in the future. This isn't about doing less together. This is how are we going to do more together. So our ability to sustain and then to be able to grow and improve access in the care that we provide rises and falls on our ability to invest the necessary capital to do that. Alone, I don't believe for the foreseeable future that we're going to be able to do that in a way that delivers the type of care that our patients deserve. Together, I'm confident in our ability to do that.
Yeah, the problem with that argument is we're very proud of the care delivery systems in the metro area, the Twin Cities. We are an incredibly efficient marketplace because of the current competition. As Bill talks about, us coming together doesn't change the nature of the current competition, right? Because there's no overlap, so we don't get any more market density. But what it does come down to is we have to be able to continue to lower our cost structures. Right? At the end of the day, I don't set prices for patients. Health plans do. Yes, we negotiate with them, but in a competitive market, the negotiations are what everybody else gets, basically, right? So you don't gain leverage there. But what we can do is continue to drive down our cost structure. How do we do that? Well, one is we get more people. It sounds ironic, but we pay for outside labor because we can't get enough people trained and available for nursing, right? That's one of the biggest problems in our country right now, is a lack of nurses. We go to agencies to bring them in at a much higher cost. I would much rather employ nurses. We make them more efficient. As again, I'd cite the study that showed that nurses get to spend 25% of their time in direct care, 75% in other things. Well, let's take away that waste. Let's take away that burden. Make people more efficient and focused on the things they went to school for and what they care about, which is delivering care. Those are the ways that we can continue to lower our cost structure. And when we lower our cost structure, if the health plans are amenable, we can lower our prices. But only they get to mediate the price to the end user.
a lot of the concern about quality and safety being voiced right now is from some of the unions involved in the hospitals that are currently there, and also from what would be a partner in all of this, the University of Minnesota. How should Minnesotans feel confident in a merger going forward when the status of one of those potential partners seems to appear that they want out?
Well, I'll start with organized labor, right? And this is not intended in disrespect to anybody, but we would expect that the unions voice a concern when you have changes in business, when you have mergers or you have acquisitions, that pretty consistently it would be the unions that would show up in concern or even directly in opposition when this happens. And so one of the benefits of having spent the time attending, speaking at the listening sessions that have been hosted by the Attorney General is we get to hear firsthand what those questions are, what those concerns are, and those are helpful, but perhaps even more helpful is the time that James and I have been able to spend walking the halls of our medical centers, going to our care sites, and then talking directly to those individuals who are represented in their day in and day out providing care in those sites. And generally the questions they'll ask us that they really want to know at the end of the day, and they're appropriate, is, can we trust that, our contracts that are in place are going to be honored? And without equivocation, my answer is yes. And oftentimes we'll get asked the question, well, Sanford Health, from the Dakotas, you don't deal with unions. And so that's inaccurate. Today we proudly have 25 collective bargaining agreements at Sanford Health. 22 of those units that are represented are in the state of Minnesota. And so we very much care about, we're proud of the work that all of our teammates do, whether they're represented or not. And so that's not something that needs to be of concern as you go forward. Again, I just invite you to look at the communities where we've been able to grow with in the state of Minnesota already. We have a long history of honoring and respecting those agreements, and then more importantly, the agreements of the people, right?
Yeah. Well, let me ask you just quickly on that, because I kind of double loaded two really big questions in there, so I apologize for that. When responding to those questions, specifically from the unions, there was just a very large negotiation that was finalized. There was language in there about staffing and voicing and staffing. Do you imagine any kind of changes, either to the contracts or to some of those agreements in place to have better communication around staffing?
So I would say this way, the contracts that are in place to that specific question, we are absolutely going to honor those contracts. There's no intent to do anything but honor them as they're created. Again, setting aside the contracts, whether you have a group of employees who are represented or those who are not represented, communication is always key. It's extremely important to make sure that we're communicating with our caregivers. We don't do anything in healthcare except for that which we do through our people. And so that's always an opportunity, and it's always a positive thing when we do it really, really well. And so that'll be something that we continue to focus on more and more. It's part of why James and I have been very intentional about being out, spending time, walking the halls and looking individuals in the eyes and letting them ask us questions that range from everything to, am I going to have to change my uniform? Which matters to people. There's costs associated with that. There's identity associated with that, to my benefits. And we want to make sure that we're there to answer them, look them in the eye, and assure them that those are not things that they have to be concerned about.
I do think too often two separate issues get conflated. So at Fairview, we have both represented and non-represented nurses in both environments, in either type of hospital. At the end of the day, it's the charge nurses and the nurses who are making decisions about what's the appropriate staffing. Right? So that doesn't come to me, that doesn't come to any C-suite. That happens on the floor because that's where the patient care is happening. But what gets conflated with that is we have a severe nursing shortage, right? So people are working short-staffed. That is not because we don't want to hire nurses. It's because there are not nurses to hire. I mean, our unemployment rate in Minnesota is practically, for all practical purposes, zero. So the staffing issues often, and I feel for the nurses, I feel for all the staff who have to work in understaffed conditions, and we're doing everything we can. But again, I put this into the context of what can we do together versus separately. So our ability to train more, to be able to develop programs, I mean, healthcare is an incredibly rewarding career, right? It feeds the soul, but it's also economically very rewarding. if we can get more people into healthcare careers and if we can support those endeavors, well, that investment can be more leveraged, if you will, if we're together than if we're separate. And I think you can look at Sanford's track record on that and ours in terms of pipeline programs and reaching all the way into middle schools. But we can just amplify and develop those in a much more, I think, significant way.
Absolutely.
So, to the other big elephant in the room, you heard my question, but essentially, why should Minnesotans be confident in a merger when one of the potential partners has made it very clear at this point that they are looking to get out of it?
Let me take the first shot at that, because I've had the partnership with the university. And I've been in academic medicine quite a long time. I was at Stanford, the other S word, in California, a fairly well-known university. And first of all, I would say from the get-go, when Bill and I first started talking, one of the things that was important to me was how did Bill feel and how did Sanford feel about academic medicine? And at the very initial point, Bill was very supportive of, saw the value that academic medicine can bring. Second point, the university is an independent entity. We can't make decisions for them. What we have done all the way along is look to engage them, to be able to want to co-create what the new relationship could look like. They announced recently in a very public forum that they want to control their own destiny, so to speak, to have the academic assets. We had already put that on the table as a range of possibilities because, again, we come at this from, you're the University of Minnesota, you have to chart your own course. Of course, we'd like you to be a part of the system in some form or fashion, but we're open to any and all possibilities. We just think it'd be a shame if we can't work out some relationship because every academic in the country needs to be associated with a care delivery system, either of its own creation or through some other relationship, because you can't be the ivory tower on the hill. And essentially, that's what the university proposed, right?
If I could, just one thing to add to that is, I think another thing that's important to clarify, and James and I had the opportunity to do that yesterday at the legislative hearing that we participated in, and that is the conversation around the university and its future that it has charted has absolutely nothing to do with the merger between Sanford Health and Fairview Health Services. And what sort of gets lost in the public conversation in some of the political theater that ensues is the reality that there's a contract that's in place, and keep me honest in this, James, between Fairview and the university, its medical school, and UMP, its faculty practice plan. That agreement runs until 2026 at its natural term. And also as a part of that, this is a decision-making year where either party can give the other one notice that they don't intend to renew it at the end of 2026. So if Sanford Health is never having a conversation with Fairview Health Services, this dialogue is transpiring regardless of us. It just so happens that they're happening at that same time. And so what we want everyone to know, what we've made very, very clear ever since our very first meeting in August with the university, we stand at the ready to do everything that we can to be supportive of its mission. And that includes a tight affiliation like what exists today, all the way up to something that's more akin to what you heard them announce a desire to do, which is to repurchase a hospital that it had sold to Fairview in 1997, and then go at it with more of sort of a pluralistic type of a relationship with multiple different entities. We don't want to be seen as an impediment to that. We want to be seen as a good partner. But the university's indecision around what it is it wants to do and how it wants to proceed should in no way, shape, or form hold back the independent nature of Fairview and Sanford from going forward and charting our course. And so while they oftentimes get blended together, because the university is still in the process of deciding what it wants to do, doesn't prevent other not-for-profit health systems here in the state of Minnesota from doing the things that they need to do and executing on their strategies. It shouldn't here either.
But part of the reason why they're now at this crossroads, as far as I've understood it, is that they weren't part of those original discussions, and they felt as though they were not included in any of the planning. And that's one of the reasons why, in their words, they don't feel as though interests have been adequately considered.
Well, let's start with the facts. So Bill and I first had a conversation. We had a dinner together at the end of May last year. And in that conversation, as we talked about the aspirations we had for our organizations, we came to the conclusion that there could be an opportunity to work together. So that's May 31st. Through the course of the next 2 months, we explored that. That was not a fait accompli. We didn't write an LOI at dinner that night. We got together over several meetings to support that. Now, as I already said, having a conversation at that dinner was also part of how would the university fit in. Do you see that as an opportunity? Before I ever informed my board as a whole, my board chair and I sat down with university leadership, Jacob Toller, Myron France, and Doug Peterson, their chief legal counsel, two of whom, Jacob and Myron, are on my board. And we told them this conversation is going on and we deeply want to co-create a new future with them. So the rhetoric around we haven't had time and weren't included, I think is a little bit of a misdirection. We have been, and Bill and I both said, we'll meet weekly to work with you to co-create what this could look like, starting in August. Well, since August, 7 months ago, we've had 7 meetings. So I don't think it's a matter of time. I think it's in part a matter of interest and alacrity on the part of the university, but we stand ready to continue to have those conversations at any tempo, at any duration that they want to continue to co-create or explore. Now, they've announced a vision that would seemingly chart another direction. Okay, fine, let's sit down and explore that. But this wasn't an issue of we didn't include the university. Two 501c3s sat down and said, is there an opportunity? We studied that. We said, yes, we believe there is. And at that moment, we included the university.
Yeah, and one other point on that too as well is there's no sense in having a conversation with the university if Sanford and Fairview didn't want to come together.
Right.
Because as a practical matter, the merger occurs between those two entities, not between the state. Obviously, they can't do that. But moreover, that's where the important piece and why you've heard James and I talk about this so much. There is a contract that is in place until 2026. Neither Fairview nor Sanford and Fairview as a combined system have the ability to terminate that agreement until it ends in 2026. There's actually only one entity that unilaterally possesses the ability to terminate that contract before 2026, and that is the university. And so as a result, it's why we say with so much confidence, there's not a rush, there's nothing to be concerned about, there's nothing that happens to the university. It's funding, it's teaching mission, it's access to the facilities. None of that is affected in any way, shape, or form as a result of Sanford and Fairview coming together. There's plenty of time left for the university to determine on its own what it is it wants to do, informing us of what role we can play in that, and we're happy to do so.
You say there's not a rush when it comes to the university and this plan. Timelines have been talked about by the Attorney General in that there shouldn't be a rush to approve a deal so big like this that has implications with taxpayers and the university as well, even with that agreement still in place. There's a lot at stake here. What is your response to the Attorney General saying this needs more time?
As I shared yesterday with the legislature, with all due respect, I know it seems like there's a lot of time for other people as it relates to bringing the two organizations together. But for me, for James, importantly for all the caregivers in our organization, time is of the essence. What we do every single day, more importantly, what our physicians, what our clinicians, what our technicians do every single day is life and death. And our ability to be able to continue to do that and to do that in a sustainable way into the future is critical. So every day that we delay bringing the organizations together is another day for missed opportunity to create that sustainable environment that protects our employees, that protects our patients. It misses another opportunity for us to be able to make the type of investments that we've talked about for the betterment of our patients and for our communities. And so as we look ahead to this, for us, it's making sure this is a lawful transaction, which we know it is. And now we need to move forward with a sense of urgency to be able to start realizing those benefits for our patients and for our communities. And so it is very important that we do that. It's very important that we proceed in a quick fashion in order to do that. And so my commitment has been to Attorney General Ellison, and my hat's off to his office. They've done an incredible job, I think, through this, leading through the public sessions, as well as engaging us on the appropriate discovery that they need to complete their review, has been that we're still 2 months away from the target date that we set. And James and I have been very clear. We are not the final say on that date. We need to work with our federal and our state regulators to make sure that we satisfy their questions. And we intend to do that. We're working every single day to answer those questions, and we'll continue to work alongside with them. But with 2 months to go, I'm not ready to sort of call it quits and say, well, there's just not enough time left. And so my commitment is that I'm going to work very closely with his office. I'm going to answer his questions and make sure we provide all the necessary information for them to complete their review.
Can I add to that just a bit? So I always think of the John Wooden quote, "Be quick, don't hurry." I don't know where this idea that we're hurrying came from. Now, yes, as you can imagine, bringing two organizations of our size together is a non-trivial task. It takes some planning. And one of the ways that mergers don't go well is the two organizations don't do sufficient planning to make sure that when they do merge, they know what they're going to do, what the structures are, how are they going to take advantage of this new set of capabilities, this new size that they have. So part of what that date represents is what Bill and I have been working with our teams around thinking about the planning so that when we do close, that we're ready to go for all the reasons Bill just mentioned. We do important things, right? We take care of people when they're having a heart attack, a stroke, they're at their worst, they're at their, a sense of their own frailty. It's important that we're there for them. And when we merge, we want to be able to take advantage of all the opportunities we have as a single organization. That takes planning. So that March 31st date has always been a planning date for us to use to make sure that we're moving forward in a quick but not hurried way. We don't have control, as Bill said, of that final date. That's in the hands largely of the FTC. So that's fine. We're working with the AG's office to make sure they get all their questions answered. But just to be clear about how that date plays into this, largely that's an internal planning date for us.
How do you ensure that this planning has been finalized and that you're confident in that plan when there's such a major piece that's hanging out there unresolved, even if it's 2 years down the line?
Well, the easy answer to that is
3 years.
Well, right. We know when we close, nothing changes for the U. Again, to stress a point that Bill made. So in the planning, the U's there. All the work that we've done over the past 5 years with our service lines, our ability to really, I think, do fairly amazing things with the university, the capabilities they bring, deploy that across all of Fairview's hospitals and assets, that's still in place. Now, the question is, how do other things work that are beyond that, or the administrative tasks? That doesn't necessarily impact the university one way or the other, or how our model works. So that's actually not that difficult, right? Because care is largely going to continue as it does now for everybody. But we'll start to take the advantage of the opportunities where we can to be able to start to drive innovation, to find ways to come together and collaborate in new and better ways. That's important for us to take advantage of so that we aren't one of those cautionary tales that said, well, they merged, but nothing happened. People can't have it both ways, right? We're either going to, with purpose, make things happen in our merger and demonstrate that this merger does that, or you can't say, well, the merger wasn't successful if you don't allow us the time to do that.
I struggle a little bit with the urgency piece of this when you're talking about patients and life and death and everything being in the balance. Yeah. When you've had people at that academic learning hospital expressing the same types of concerns if this goes through without a plan for the future for the university, what do you say to them? Because they're arguing essentially the exact opposite for more time because of those concerns.
Yeah. So I would agree with you. What they're arguing for is more time. The rationale for that request is not as clear as you articulated there. I would respectfully disagree because of everything that we've stated and what we know to be factual, that when the deal closes, absolutely nothing changes with their resources, nothing changes with their funding. there is nothing that changes. And so what may be behind a request to delay, that's for them to answer. I obviously don't speak for the University of Minnesota, but it's absolutely, as a factual matter, unrelated to the continuation of the care that they're able to provide today as a part of their relationship with Fairview. It's just intellectually dishonest to suggest to the contrary, knowing that the contract, which ties it all together, remains fully intact. And in addition to the letter of the law, we've provided written assurances to all the parties that as a combined system, we will uphold every aspect of that agreement, and will do so all the way to and through its contractual term, which again is not affected by the merger.
Let's just talk a little bit about culture and politics, because it's been raised quite a few times. These are two nonprofits coming from two different states that have ideological differences right now, and that has been politicized through gender affirming care and abortion care, reproductive care. There have been a lot of questions raised about what happens to that kind of care if this merger goes through. What do you want to say about that?
Well, it's a great question, and it's asked with sincerity. As we have an opportunity to go to the listening sessions, as we have an opportunity to spend time rounding in our medical centers, that's one of the more sincere questions that we receive. And my response to them is first setting the context. Oftentimes in sort of the political theater, it's painted as the Dakotas are going to come into Minnesota, which again is just factually inaccurate. Maybe the Dakotas came into Minnesota a quarter century ago. We've been providing incredible world-class care in the western third of Minnesota for the past 25 years. And so Sanford Health has both the privilege and the responsibility of providing care in a multi-jurisdictional way, providing care on the acute side in the state of Iowa, South Dakota, North Dakota, and of course in the state of Minnesota. And so we know very well how to provide care, provide world-class care, and to do it in a way that's uncompromising, still complying with the different state and then of course the overriding federal laws. But as it relates specifically to questions around gender affirming care, questions around abortion care, what I have assured everybody, even as recently again as yesterday at the legislative hearing, what we've committed to in writing for the Attorney General's office and many others, that the way in which those decisions are made today, those decisions are made by the providers who are privileged and credentialed to provide services at those medical centers, and then those decisions are affirmed and approved by the local boards. That's the way in which that will happen in the future. And I constantly remind people, don't take my word for it, but what we've committed is the bylaws for the new organization will expressly state that as well, so that nobody can be concerned that there ends up being some sort of a corporate policy where you have people sitting in a corporate headquarters deciding what type of care is provided. And so today, the gender affirming care, the abortion care, and the abortion services that are provided today in the state of Minnesota, those are going to continue. They will remain unchanged as a result of this merger. And I think that's very important that people understand that the way in which those decisions are made between that sacred relationship between those physicians, providers, and their patients, that's going to continue into the future.
And it will be in writing in the bylaws?
It is, yeah. And we've already made those written commitments as well and assurances to the Attorney General's office.
Okay. We're back here again, right? I'm not, but this has been tried before.
Practically speaking, any of us are.
Right. This has been tried before, and it did not happen. Sanford has worked on mergers elsewhere as well that did not happen for various reasons. Sometimes there's talk of culture. Sometimes the Attorney General has gotten involved. Why has this not happened in the past, and why is this time different, I guess, is what I'm trying to ask.
Yeah. I'd start with this. I think it would be inappropriate for me or for James to speculate as to the past. We weren't serving in these roles. We had different leaderships at that time. But what I can say today, 10 years later, is that as we've discussed, there have been some significant changes that have happened or are going to continue to happen in the world of healthcare. There are significant pressures and headwinds that are facing and really threatening our ability as not-for-profit healthcare delivery systems to do what we do and to do that successfully into the future. And so those threats are more real today than they've ever been before. And our ability to come together, to combine our resources, to be able to combat those, to be able to drive through and ensure the access to world-class care, the ability to provide higher quality care and more equitable care, we know and believe to be stronger together than it is alone. I think the other aspect that is important is at Sanford Health, we have now another 10 years under our belt of having demonstrated the type of care that we provide, the type of partner we are to the state of Minnesota. Again, 2 weeks ago, we had the opportunity to share a great success story as we merged and partnered with Bemidji. And as we did that, we invested over $100 million of strategic capital into that market. And so questions and concerns about less and culture and things changing, that's not what we heard in the community listening session. That's not what we see day in and day out. What we do see as a direct result of that merger is increased access, improved quality, more specialists, more employees, greater economic development. That community is better, and all the surrounding counties that they serve are better because the two systems came together and merged. And it's that type of vision, it's that type of reality that we'll achieve as Sanford Health and Fairview Health Services come together to do that and more for the whole state of Minnesota.
Yeah, let me make a comment on that. I've been at this a long time. I'm 33 years in healthcare. Mergers like this fail for several reasons, right? They fail for manners of ego. The CEO's egos get in the way, or the board's egos get in the way. That's not the case here. They fail because of a matter of law. Well, Bill and I firmly believe there are no matters of law that are at odds here. They fail because of matters of culture. The two organizations' cultures are just fundamentally different. I've had the privilege of spending a lot of time at Sanford Health over the last few months. Bill has had the privilege of spending a lot of time at Fairview Health Services. I don't discern a lot of differences between our cultures. We're community-based, focused on our patients, focused on the betterment of our communities. That's what drives people in both organizations. And as a non-Minnesotan, so I grew up in Montana, so I feel like I'm somewhat of an outside observer to Dakota's and Minnesota culture. I don't see all that much difference in the cultures of the states, frankly. I always kid Bill, there's 2 degrees of separation between every human being in Minnesota and the 2 Dakotas. If you don't know them directly, you know somebody else who knows them, right? So I think a lot of this has been somewhat distorted about something that isn't real. So whatever the factors were in 2013, the egos aren't involved, the matters of law aren't involved, the matters of fundamental culture of the 2 organizations are aligned. There is no conceivable reason for me, other than lack of will, and hopefully what you see from Bill and I is there's no shortage of will to make this happen.